All right. Well, good morning, everyone. We're getting started here. Thank you very much for your patience. It is another fantastic Monday morning here at Health Plan Markets. It's April 1st, 9:02. Happy April Fool's Day. Play a nice joke on someone. No, I hope everyone has a fantastic first week of April. It is the beginning of Q2 and the official day of what we call lock-in for Medicare. So this is what many carriers call rest of year, but there is so much to do during this time. I don't want anybody to fall asleep or get discouraged on what to do next. So we're going to talk about some of those things today. But very excited to get started. As we normally do, we are here to improve the lives of our community with affordable healthcare. And thank you for being a part of that mission. It is more important than ever with some news I'm going to share with you today, because unfortunately there's some bad eggs out there. So with that, I'm going to jump over to our training calendar to ensure that everybody has one foot in the classroom and the other one in the field at all times. So not much going on this week, but very, very important training for tomorrow. Today we are launching our very first program called HQ, and this is our brand new portal system that was designed for agents and soon to be agencies as well, with lots and lots of features. So if nothing else, please join me tomorrow afternoon at 3:30. I'm going to do my best to keep it around a half an hour deep dive session into our brand new platform called HQ. And I'm going to give you a little sneak peek later today, but I'm going to go ahead and put that link in the chat for you right now. So if you're online, you can go ahead and jump into the chat and just save this link. This is for tomorrow at 3:30. You can log in right there. We're trying a new platform with Webinar Jam. So check that out and we'll see how that works. But tomorrow at 3:30, we're going to be discussing our brand new agent portal with yours truly. So please mark your calendars and make sure that you're there. And we are going to do our best to record it so that way you have something to come back to later down the road. Very, very, very excited about this. We've been working a very long time to get this launched. So we're excited to share that with you on Tuesday. Okay, also on Wednesday, we've got our very own Al Clancy, our virtual coffee and chat session. He is available to answer any questions and coaching, your very own insurance coach, available for you at 9:30 every Wednesday. Just go on over to the training calendar and you can register for that one there. Cigna still has their virtual office sessions. That's matched up with our contracting Q&A session that happens every Wednesday at 11 a.m. So any contracting questions, comments, issues, you can join both Jessica and Sam to answer any questions that you might personally have with contracting or any jam ups that you might have or updates or whatever the case might be. They are making themselves available every Wednesday from 11 to 12. So that's there. And then lastly, on Friday, we've got our HPM shop training. This is our quote and enroll tool for Medicare Advantage. Those of you that are relatively new to HPM, this is a great opportunity to spend some time with Tom Ryan, who has some expertise on how to get started with HPM shop. There are going to be some changes coming down the pipe for 2025. And so sometime in the late summertime, we'll have an update on HPM shop. But for the meantime, everything should function relatively the same from year over year. They've made some great changes over this year. The site's now integrated into one site, so there's no need to change those sites year over year and learn and relearn it. So that is the training for the week. Remember, keep one foot in the classroom and the other one in the field at all times. All right. So on somewhat of a somber note, I do want to share with you guys some terrible things that are happening in our industry. I am going to drop a chat in the chat a link to an article that was posted by NPR that I read this morning about some bad eggs. And the title is ACA Health Insurance Plans Are Being Switched Without the Enrollees Okay. And so, unfortunately, there are some nefarious agents out there that are switching people's health insurance on the marketplace without their permission or knowledge until it's too late. So, I know none of you are doing this, but I am aware that many of you are on defense because of this terrible thing that's happening out there. It's running rampant. We know that CMS has started to put some things in place to prevent things like this from happening, but they're still behind the eight ball. But we're seeing that mostly, if you read it in the article, most of it is happening in the federal marketplaces in the FFM versus the state-based marketplaces. Seems like the state-based marketplaces have a little bit more security features that are there to protect consumers from having agents go in and change their plan. But let me tell you how really upsetting this is. People rely on their health insurance when they get sick or when they have an accident. And if somebody is going in there and changing a person's plan without their knowledge or permission, and that person goes to access healthcare and they can't see the doctors, they can't get their medications, they're completely lost, and they've lost their broker that helps them. So this is not only just greed and disturbing, but this can literally kill somebody. It's just very terrible that this type of activity is happening out here. So, what can be done about it? On the federal government side, they are taking some precautions and working on, different situations out there that essentially could prevent a lot of this activity from happening. But I'm not going to wait around for that. What we have to do is take specific action to ensure that our members are protected and that we're paying attention to that. So if you go to your Health Sherpa account, and when you're logged in, hopefully you guys can see my screen here. When you're logged in, there's a new feature under the clients here that says at risk AOR. And I don't sell anymore, so it's really not going to show you much of anything. But what Health Sherpa, and this is another reason why we really like working with them, is Health Sherpa, if one of your members has changed their plan or changed their agent of record, they're sending you a notice up top here where you can pull a report, and it says at risk AOR. And here is where they list, you may no longer be AOR for these clients. The list is sorted with the most recent entry first. And they've got a whole article on it that you can read about, what does this mean, how you can export this information, and then what can you do if you suspect that there's fraud happening. So that link out is right there, so you can go in there and just ensure that you've addressed any AOR changes. Now, some clients may have reached out to another agent and started working with another agent, and that's legit. Okay, not much we can do there. But if you're calling your member and they're saying, I never changed my doctors, I never changed my plan, then you've got a case here. And so you can go through these articles. There's an email that you can email in case you suspect fraud, in your book of business. But we do know that this is running rampant, and not only does it affect you, but it also affects us as an agency. We're responsible together to protect that client book of business on behalf of the carrier. That's what our contract says. So we've got to do everything that we can to protect that book of business. So if you do have, if you see any of that happening, please don't hesitate. You can let us know, or you can call CMS or send them an email. on some issues that might be happening. It's especially powerful if you let your clients call CMS as well. Um, Especially if they have an urgent issue where they have to see the doctor. This is unscrupulous activity. It's dangerous and it's unforgivable. Agents are out there just switching people without permission just to make a dollar. It's really quite disgusting. So I'm hoping that all of you are taking precautions and ensuring that your members can call you if they have an issue, but that also you're taking a look and making sure that you're protecting your book of business, and that's another reason why we should be using Health Sherpa, because they are identifying any at-risk members on the AOR policy. So really nice feature I wanted to share with you guys this morning. Lastly, we are making an internal change. As we had discussed last week, we are moving to a weekly commission cadence. So we are now processing commissions weekly. We processed commissions last week, so this is our first week of commission switchover. And those of you that are getting paid by HPM as an agency, or if you're receiving commissions from us because you're doing certain ACA plans like Ambetter, which requires us to pay, you have been invited to set up your Gusto account. Gusto is our new payment system that allows us to cut checks more frequently and has a really, really slick platform that makes it easy for you to access your payment information. We realized that we have outgrown the previous solution, and we're making those changes now, so we're better prepared for the future and ensuring that you're getting your money quick and often without having to wait 2 weeks. So our goal for 2024 was to bring weekly commissions to you in order for it to be as seamless as possible, and also to be best in class in the industry. I'm hoping that this makes a change for the better for everyone. I don't think we're going to do any more than weekly because then it gets really confusing. But Gusto does allow us to make multiple payments throughout the week. So if we had to, if we missed a payment or we had a bonus or something like that, we don't typically have to wait an entire week to do a pay cycle. So those of you that are receiving payments through our bank Mercury, we, as phase 2, we're going to explore possibly just getting those payments through Gusto, so that everything's in one place versus having to search out what are these payments, when did they come in, and where did they go. We're trying to centralize it to make it as easy as possible. So that's what's going on. If you received a notice in your email from Gusto, please go ahead. That is legit. Go ahead and get that set up. And that's your new account there. If you have been sent an invite, Liam is going to reach out to you as well. And if you don't get that done by tomorrow, then it's possible you will miss the commission payroll cycle for Friday's deposit. So just make sure that you get that done. If you got it done, you should have gotten a confirmation email, no problem there. And we'll get you set up for payment. So we're going to be doing that tomorrow for our first weekly payment. So moving forward, we'll have weekly payments. We're going to have a commission schedule available where you can go in and see which carriers are paid on what days. But essentially, you'll be paid every week, which should increase your commission cadence and how fast and quickly you get your money, which I'm sure no one's going to complain about. Stop paying me so frequently. Said no one ever. So I'm glad to get some feedback on that and really excited about that. Okay. All right. I'm going to take a pause here and just read some of the chat here. Somebody said, I've noticed shop is very slow recently. That's news to me. Some common things, if you run into issues with shop, is I know it sounds very basic, but logging in, logging out typically does that. There's a way that you can clear your cookies, which should make it somewhat a little bit faster. So let me show you very quickly how to do that. In case you want to clear your cookies, you can do that by going up to the three dots here. I'm going to show you in Google Chrome. And then you can see clear browsing history. When you click that, you have the opportunity to just select clear cookies. And sometimes that really helps with some of these settings as far as getting in and out of there. So you can do that. Or just, try rebooting your computer completely. Try getting off and on the Wi-Fi. Sometimes that works. Remember that the speed of the enrollment platform does depend on your Wi-Fi connection as well. So that is a possible opportunity. Now, if none of those things are solving that problem, then please send us an email at support@askhpm.com. They haven't sent us any information about why or if it's being slow right now. So it could be just a one-off thing. But if none of those solutions work, don't forget that you can email us at support@askhpm.com or call us at 844-696-3975. Okay. All right. We do have a special guest this morning, Miss Kylie Glisson from Max Health, which is an MSO. And Kylie's going to share the good news about Max Health, introduce herself and the company to let us know what they're all about and how we can hopefully play nice with them and help them grow their business as well as yours. So welcome, Kylie.
Hi, everyone. Thank you for the introduction. My name is Kylie Glisson. As Justin just mentioned, I am the Business Development Director for Max Health. I oversee the entire Florida market for sales and marketing. Our ultimate goal is membership growth and retention. I also have on the call Maddie Preston. She is one of our brand ambassadors. We have 3 brand ambassadors. They assist with all outside sales. Maddie particularly is on this call. She oversees Hillsborough, Osceola, and Polk. And then we have Grace. She's not on the call, and Anna Rellis that also cover the rest of our Florida market. And we'll get into exactly where that is and our care model. So I'm going to share my screen. Give me 1 second. Okay, so you guys should all be able to see the broker and agents tab I have up here. So I do want to point out we only have 15 minutes, so it's going to be very high level, but Maddie's going to send in the chat her contact if you guys want to then break out into one-on-ones to learn a little bit more about our broker and agents program. So we do have a program that is offered for our brokers. It's a pretty competitive program that we have. Basically, it's bridging the gap between brokers and clients and the primary care clinics. So we'll get into a little bit of that. But before I get into that, I just want to share with you guys our locations, our care model really quick. So as I mentioned, we are all over Florida. We have over 50 primary care clinics. On our site here, you can see you can go to mymax, M-A-X, doc.com, and you will find our website. On the locations tab is where you can find a list of all of our primary care clinics. We have a very user-friendly search tool. So if you're looking for any of our clinics, you can put in either your client's zip code or you can put your zip code in where you're working to kind of get a better idea of where we are locally to you. So if I was with a client right now and I wanted to figure out what the closest location is, you could use my current location, and it's going to give you a list of all the locations closest to you all the way to furthest. So as you can see, my closest would be 2 miles away, and then I would click into clinic details here, and you could see a little bit more about the clinic and our providers. So this is just a really handy tool when working with clients and understanding, what might be the best clinic for them, as well as just so you have an idea of our territory. Now, the specific county. So I already mentioned Hillsborough, Osceola, and Polk. We also have Pinellas, Pasco, Marion, and Sumter. And then in Southwest Florida, we have Manatee, Sarasota, Lee, Collier. And then in South Florida, we have Miami-Dade, Palm Beach, Okeechobee, and Broward. So we are truly across Florida, with it being about 50 plus clinics. We also have a providers tab. So if you're wanting to learn more about our providers, we offer providers with several different, we have genders, languages, insurances. So we have several different filters that you can filter out. So let's say that you have a client that is very specific about the gender of the provider that they're seeing, or if they need specifically maybe a Spanish speaking provider, or if they already know that they want to go ahead and be with a specific health plan, you can filter it out and it will narrow from over 100 providers down to about 5 or 10. So this is another really handy tool that we have. You can also do it by county. So let's say you're in Hillsborough or Osceola. It's going to take it from about over 100 providers down to about 20, and you can go in and dig a little bit deeper on who those providers are. So just so you have an idea of locations, and then we'll go into the care approach really quick. So one thing I always like to point out is that Max Health, we are pretty much credentialed with all major payers. And when I mean pretty much, I mean 99% of them. The reason for that is that we believe that we never want to lose a patient based off of the health plan that they're wanting. So that is kind of our main goal, is to make sure that our patients are happy and that we don't ever lose them based off of the plan. So that is the first thing. The second is kind of just a little bit about Max Health. So Max Health has actually been around since the 80s with Dr. Raj Nayak. In Tampa. He's one of the first people to ever do managed care, Medicare Advantage plans. And then he recently, in the past 5 years, sold partial of his company over to a private equity firm, where we then had the capital to then expand. So we have truly, that is why we've expanded so much, which has then given us the opportunity to provide more services for our patients and a better care for our patients. And so when we rebranded to Max Health, we wanted to regroup and refocus. And so the two things that we came up with that we knew would help stand out is that we wanted to go back to the basics, which is proactive care and personalized care. So as much as that we may be a larger entity, we still wanted it to feel like a family-owned clinic when you walk into the door and giving that personalized care. So I'm going to kind of go over a couple of things that make Max Health a proactive and personalized care. So if you scroll down here, here's a list of all of our services. I am going to go into our broker program the last remaining 5 minutes that we have, but just really quick. We do offer self-scheduling. I will go over that when we get into the broker program. That is where the self-scheduling comes in to play. We do have access, 24/7 access to a provider at any time. They all have access to our ECWs. So that being said, anytime after 5, we do have a provider on call to answer any questions for our patients. We do offer free transportation, not just through the health plans, but through Max Health. So door-to-door service, so pick you up, drop you off. We use Uber Health. And then we also offer for events. So if you guys ever are doing Medicare seminars with one of our brand ambassadors or anything of a grassroots event, we do support our patients getting out of the house and going and socializing. So we do also offer free transportation to those events as well. We own a pharmacy, so we have free mail order pharmacy with medical reminders. We do the bubble wrap and everything. So Monday through Sunday, AM, PM, we can do all that for them. So it makes it a lot easier for them to take, track the medication that they're taking. We have a patient portal, so they have access to their medical records and referral statuses. Home care, we do not do home care, but we work very well with our specialty groups that do the home care. But if you have a patient that cannot leave the home, we do offer telemedicine. That is something that if they are too sick to travel or whatever the case may be, that we will offer that and with all of our providers. I did mention we are bilingual pretty much in almost all. We offer bilingual services for our patients. We offer same day appointments for current patients. So what does that mean? On average, we have about 15 appointments a day. We leave about 3 open every day for patients that need to come in that are sick, and instead of avoiding the hospital if it's not emergent, to get them in to be seen. That's something that I really like to say. When people ask me what are things that stand out about you, I would say the access to care that you have to our providers, which is not everyone can say that they can see their patients on the same day if there's an emergency that comes up. So that's one of the biggest things. I mentioned we have over 50 locations. I already mentioned the telehealth. We do have labs on site, so they don't have to travel across town to go get their blood drawn. I think that's another huge thing. It just makes it more convenient for them. And then we have a dedicated care team. I'll quickly go over what that looks like. That's not just our providers and our MAs, but we have a full staff that makes sure that we take care of our patients, that it takes a village to take care of them. So I'm going to move down here. So you're going to see, obviously, we have our providers, we have our clinical assistants. I mentioned we do have a pharmacy technician, but we also have what are called patient advocates, health coaches, and care managers. So our patient advocates work very closely with our brokers. That is my internal sales team. They oversee all of the new clients that our brokers send through our program and make sure that they are onboarded. So making sure that they are scheduled on a timely manner, that they're seen, making sure they communicate back with the broker, making sure that all their questions are answered. So you can see on the right-hand side there, just some of the things that they do to help assist. In addition, because our patient advocates are really focusing mostly with our broker partners, we also have health coaches that assist with not just the onboarding process, but with our patients on a day-to-day basis. So once they've been established, we also have health coaches that focus on those patients. And then lastly, we have our care managers. They oversee the entire admission to discharge of any of our specialties. So whether that's the hospital or ER or any type of specialist, they watch that admission to discharge and make sure that we get them in right away to be seen for their follow-up with the doctor. So these are just a couple of things that we do to hopefully achieve that proactive and personalized care. I know I'm running out of time. I only have a couple minutes left, but I'll just quickly go into our broker and agents tab. So as I mentioned, we do have a broker program. So what does our broker program do? It does just that. It helps, again, give personalized and proactive care to our clients. So we actually ask our brokers to help assist with additional services for their clients. And in return, we see about a 99, and we have for the past 2.5 years that we've done this program, we have a 99% retention rate, which is pretty incredible. When people ask me, why is it that you have such a high retention rate? I tell them because these 2 additional steps really do make the difference with our onboarding process. So what we ask our brokers to do, we also, if they do the 2 services, this is a service program, not a referral program. We do compensate our brokers for the services that they complete. It's not based off if they even end up being effective or attending their appointment. It's just helping us with the onboarding rather than us having to employ, 20 plus of our brand ambassadors to help do this. So what we ask you to do really quick, I'm not going to go into all the details. If you are interested, Maddie has sent the contact information over. Please make sure to grab that and you can contact her and we can schedule a one-on-one. But what it is it's a quick 5-minute form here. It's the first step. There's 2. After you've enrolled them with Max Health, if they are a right fit for Max Health, you will complete this first form. It's asking for your information up at the top here, and then the patient's information up at the bottom. When you select submit, it goes into a system where our patient advocates, all they do all day is they look at these forms and they go and get them scheduled for their first appointment. So within 24 hours of a patient being enrolled with Max Health, we will get them scheduled for their first appointment and we notify our broker. We notify them that the patient has been scheduled If there's anything specific questions that they have, we also make sure we handle it. Now you're probably wondering, well, why do you need my information up at the top? Why we get your information is because we track agent of record. We are very big in making sure that we don't flip your patients. And that is how we track it. So when you submit this 5-minute form, not only is your client getting scheduled within 24 hours, but you're also getting agent of record. Where if we ever do an event with another broker, we strip out anybody that already has a signed broker. That's what that means. What it also means is during AEP, when patients call us and they say they have health plan questions, a lot of times they don't remember who they last worked with as a broker. And we will look and we have that assigned in that client's account and we can send them back to you. So that's huge. Just in 5 minutes, you're doing that. And then lastly, we also ask that you assist with an online new patient packet. It's just simply this clicking on this button here. And when you go into it, it's a little 5-page new patient packet. You've all seen it. We've all filled one out. What it does is it helps with the efficiency and of the new patient packet rather than them coming 15 minutes early to their appointment, which a lot of times they're not able to make it 15 minutes. We ask them to do it prior. Another thing is that we expect, and this is an expectation for our providers, is that they review these new patient packets prior to already set up a plan for those patients. So again, that's where that proactive and personalized care comes into. This is also very similar to an HRA, which is a health risk assessment, which you're already getting compensated to do that health risk assessment. So if you're already doing an HRA or you're already doing this, I always tell everyone, try doing both. They have a lot of the same information and it's more bang for your buck. It also really does, when I mentioned retention for my team, yes, it's great that we grow, but we want to retain, both you want to retain your clients and we want to retain our patients. And we have learned that this is kind of the secret sauce to keeping our patients happy and having a good onboarding experience. So just doing these 2 steps, which is the new patient packet prior, where they have assistance with someone walking them through it and getting the most efficient and accurate information on the patient, as well as them getting scheduled 24 hours in advance. It really does make all the difference. Also, knowing who that broker is that assigned them, we work very well with our brokers. And that's how I mentioned earlier, we bridge that gap between broker and client and primary care clinic. So I know I talked really quickly. I wanted to respect y'all's time today. I know I'm 5 minutes over. That's kind of the very high level overview. I do have an FAQ form with a step-by-step of how to complete it. The program, it is something that you have to sign an agreement to be a part of. So if that's something you're interested in, you can always reach out to us. I know that I work closely with Nick Street, so I will also make sure that he has all the information. So if you guys have any questions, Justin, I'll also make sure to send it to you. So if you guys have interest in that, they will have the right point of contact and information for you guys. But I will leave it back up to you, Justin, and I appreciate you guys providing me a few minutes of your time.
Of course, Kylie, great job. Thank you very much.
Yeah.
So a couple questions, I mean, we have some in the chat here, but they're, basics. Yes, you are a managed service organization. You have a primary care doctor network. And these are all wholly owned clinics, correct?
They are all wholly owned clinics, yes.
Fantastic. And that's important that I mention that is because what happens with independent doctors is they may not always follow the model, where these are employed doctors. So if they don't follow the model, they are invited to work elsewhere. So this is it's a really good thing as far as continuity of care. So we've got the things there. Now, I know you're working with some of our folks and other agents out there, and so you see what works. Is there anything that you would share with the team here today that's working as far as marketing and what these guys should be doing to grow their book of business?
Yeah, well, I will say we have brokers that have very different ways of growing their book of business. And I think it just depends on your demographics and where you are. What I have found to be very successful is, one, I think having the brand ambassadors that are out in the field to couple up with you. that know how to get into these, senior facilities, places where seniors are already at and doing grassroots events. Getting the name out there, right? Getting in front of them, comfortability. I think it's consistency. So, our brand ambassadors are out there. It could be the same facility every single week that they go to, and maybe not right away you're going to get that client, but eventually, yes. And we've seen it to be true. So that's where we've seen success. We already in 2 months have generated 1,800 leads.
Wow.
So that's just through our grassroots efforts. That's one part of it, I would say. I think the other key part is really going to be the customer service. How do we keep those clients, right? So yes, you can get 1,800 leads, but if you're not following up with them and you're not giving that process of the onboarding process, then you're not necessarily going to be able to keep those leads, right? So that's kind of where I have my brand ambassadors that are out in the field generating the leads. And then I have my patient advocates that are really helping with cultivating that patient experience and the onboarding. So I think it's hand in hand together.
Awesome. How many brand ambassadors do you currently have?
So we actually only have 3. They're by territory. They do about 3 events a week. Now, you might think that that's really small, but we're actually big believers in working with brokers, right? So my thing is, right, and my girls know this, is that we can only do so much. We don't have our license to sell health plan. We need to work with our brokers. So we really utilize this program rather than me hiring 25 brand ambassadors. My brand ambassadors work with the brokers on a daily basis, and that is where we see our results. So that's kind of like where our secret sauce is, that we really try to remember that at the end of the day, we have to have a broker in order to be successful. Because we can only go so far with a patient.
Outstanding. And then I know Maddie posted the compensation fee of $250. Are you paying the agents directly?
So we have 2 options. It just depends on what someone prefers. When I've talked to Nick Pryor and his team, he said it's a lot easier to go direct, but we do have that option. So we either pay them directly. So it's on an individual basis. So let's say, I think we have like 36 people on this call. Let's say 10 come to me, they want to sign up. They would individually all sign up separately. They wouldn't be as a team, and they would get paid independently. Now, let's say you as a whole, an agency, wanted to sign up and you wanted to do it where I pay the agency. We can definitely do it that way. It just depends on preference. But we have 2 different types of agreements.
No, as long as you can pay them directly, I'm happy with that.
Yeah.
So, otherwise we have to take a little bit out because of processing. So
Well,
I just
and we also have that in our agreement. So a lot of people do prefer the
Sure.
direct.
Absolutely. So that's good news. And then how often do you pay that particular?
So it's on a monthly basis because it's not a referral program. It's a service program. We don't pay off of effective date, and we don't pay off when the patient's seen. We actually pay whatever you submit, whatever services. The only thing that's a caveat is both have to be required. Both of those services have to be required. And if you send, let's say April, right? We're April 1st. Whatever Rosie, I'm just picking on Rosie because I know Rosie. Whatever Rosie sends for all of April, she'll get paid in May, but it's not going to be based off of the appointment dates. It will just be based off of the services that she's completed. Because again, we're not trying to pay off of a referral. We're paying her for the time it took her to complete the services.
Awesome. On a side note, if you can send me any information or every piece of information for that, we can bake it into our new portal system so they can click it and get information about it and sign up through our portal.
Awesome.
So
I will go ahead and send you the agreement, an FAQ, which has all the common asked questions. You asked a lot of them. And then as well as we have like a step-by-step guide. So if they need help with exactly how to complete the services. And as I mentioned, my contact information's on there. We also have it in the chat. A lot of people are going to probably need additional training on, just because I went very high level. The last thing I would probably mention is this is just for Medicare Advantage patients. We do offer pretty much all Medicare Advantage plans, though, HMO and PPO. So just to keep that in mind. And this is for true new patients. You can get compensated for current patients that are with Max Health, but only if they go from a non-Medicare Advantage plan to a Medicare Advantage plan. So just wanted to note that as well.
Awesome. Yeah, last little note there in the chat. Stan wants you to come to Brevard County. So
I get that a lot, actually. I know. We actually, and Stan, just so you know, we are in the business of continuing to acquire. So we actually just closed on 6 clinics. So with the mind of, Brevard has been a conversation of topics. So I wouldn't be surprised if in the near future or distant future, somewhere around there, that we would be expanding. So I'll make sure to let you guys know whenever we have new acquisitions and new clinics popping up.
Rosie has a question.
Yes.
More is a comment. I just wanted to let you know I've been watching your social media Facebook ad on the event here in Cypress Hills. So good job.
Oh, thank you so much. I appreciate it, Rosie.
Well, Kylie, thank you very much for being on the call this morning and taking some extra time with us. We really appreciate it. It's nice to know that there's great partners that are growing in Florida. And I have to say, your website, your tech looks pretty slick. So
Thank you.
it looks like it's very easy to use, clean, nice to look at. So great job on that.
Yeah, thank you. We try to make it user friendly, not only for our patients, but for our brokers as well. So
Awesome.
awesome.
Well, thanks again. Again, if anyone has any information or needs more information or would like to sign up for the program with Max Health, please reach out to us, support@askhpm.com, and we'll get you over to Kylie or one of her teammates. So we're happy to help with that. In the meantime, thank you all for being on the call. We're going to do this again next week, same time, same station. And we hope that everyone has a fantastic and productive first week of April. Thank you all and have a fantastic day.